Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. Every week on this program, I have a different guest, and we talk about different programs, services, opportunities that we have here at KRMC. I have a really exciting guest on the program today, so I hope you'll stay tuned, and we'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Liz Smith, new nurse practitioner here at KRMC. Thanks for being on the show, Liz.
Thank you for having me.
And you're brand new here with KRMC out at the Golden Valley Medical Center, correct?
That's right.
And your specialty is geriatrics.
Correct.
I don't know that we've had that before. I think that's new and a new service for our community.
Oh, great.
That's
great.
awesome.
Yeah.
So how did you end up becoming a geriatric nurse practitioner? What brought you to that point?
Well, I always kind of felt called to work with geriatric people. Okay. And when I started investigating school, I was a little bit older.
Okay.
And just felt like that was something that I really had a passion for and wanted to do.
Now, were you a nurse before you became?
I was not.
Okay, so
I was not.
I went right into being a nurse practitioner.
Yes, I did a bridge program with Vanderbilt University.
Okay.
And bridged in with about 90 undergraduate credits into their program. The first year became an RN, worked a little bit as an RN, and then moved into the nurse practitioner master's program.
Excellent, and that is, I think, if I'm correct, you have to have a master's to become a nurse practitioner, correct?
They're working, yes, they're working in that direction, and,
right.
and currently they're working toward having a doctorate degree as well.
Even more.
So
that's
yes.
a lot of training. That's a lot of school.
It is. Yes.
Very good. Mm-hmm. So you shared with me before the program you're from Michigan originally.
I am.
Right? So we're born and raised there?
I actually was born in Ohio.
Oh, okay.
And went to Michigan for college, met my husband there, and we kind of stayed there and then moved all over the country and ended up back there.
Oh, and so you were in Michigan then, and that's where
just prior.
Okay, and that's where you went to school and got your MP?
No, that was in Tennessee, one of our many moves that we made through the years. Yes.
So what does your husband do? Is it him?
He's a minister.
Oh, okay.
He's the pastor of Dolan Springs Baptist Church.
Oh, very good. So that's how you, because you're in Dolan Springs,
Yes,
you
that's
shared
where
that
we
with
live
me.
right now.
Okay, so that's how you ended up in Dolan Springs then.
Yes.
Isn't that how life brings us together and opens doors
Yes,
as we need
that's
it to?
really true.
And so that worked out well for us and for you that we had the position at the Golden Valley Medical Center.
Yeah, it's a great opportunity.
Well, and of course, as I'm sure you're learning, we do have a high senior population in Kingman and the
Yes.
surrounding area. So
Yes, I've noticed that, kind of a retirement area.
yes, so I would think that you aren't going to be at a loss for patients.
No, quite a few already, which is
Good.
great.
You kind of hit the ground running.
Yes,
When
for
did
sure.
you start at Golden Valley?
It's been 3 weeks now.
3 weeks, okay.
Yeah.
So you are brand new. Very
Yes.
good.
Yeah.
Still getting your kind of bearings, I would imagine.
Yes,
but,
definitely.
But you showed you've been in the Dolan Springs area for about a year, so you kind of
Yes,
know. You're
that's
familiar
correct.
with all that. Very
Right,
good.
right.
So before you went to school to become a nurse practitioner, what were you doing?
I was a mother.
very
I
good.
raised my 2 daughters, got them in school, and then decided it was time for me to go back and finish my degree, and that was a good thing because I changed my major to nursing. So
What was it going to be before?
journalism.
Oh, well, now I know where to go if I need help writing in my department. I'll keep that in mind. Very good. Well, so then you went into nursing. That is a bit of a segue.
It's quite a
Difference.
shift.
Yeah, it is.
Yes.
And it's great that, like I said, that you're here and focusing on a geriatric side. What do you feel are the probably the primary health concerns that the seniors are facing in our community?
Well, currently it would be watching out for the flu.
Oh,
Definitely
right, to make
getting
sure they
their
get the
flu
flu
shot,
shots. Right.
pneumonia shot if they haven't had one.
Okay.
A lot of management of diabetes and things like that, congestive heart failure.
So weight management obviously plays into both
weight
of those
management,
as well.
exercise and diet for sure.
Okay. We were talking about immunizations, and I don't know if you're even aware yet that KRMC does quite a bit of free flu shots out in the
Yes.
community. We were at the rodeo in September, and then we're doing the walk away from drugs, and at the Women's Health Expo we try to get those out there for the folks that don't have insurance or can't afford them. But in addition to the flu shot and the pneumonia, I just happen to have my well woman this year, and I'm over 60, so my practitioner mentioned to me shingles shot as well. I haven't had that one done yet, and she said I should think about it. But what are the pros and cons for the shingles? Is there a con against not getting a shingle shot?
Probably not. I mean, most people could definitely use it because once you've had shingles, you know that you never want to have that again.
I've heard it's pretty bad.
It's pretty miserable.
And for us baby boomers, where they didn't have the chicken pox immunization when we just got it.
Everybody got it. That's right.
So we have that virus, and that's my understanding is once you have the virus in your
once
system.
you have it, you're more likely to get shingles or at least at risk.
Okay. And now, do you get it like being in touch with someone who has chickenpox, or how?
No, you have the live virus floating around in your system.
Okay.
So if you've had chickenpox, you can get shingles because it's the same virus basically.
Okay. So it would just like for no reason, just all of a sudden get it.
Correct. If your immune system's low, you're more likely to.
So like stress or just other issues.
Being sick. A lot of the geriatric population gets it because they have been sick.
Okay.
You know. So as long as you're healthy
like
and maintaining.
adding to the pain. You're already sick and then you get that.
Yes. That's true.
Are there side effects with the shingle shot at all? I mean,
not really, not to speak of.
Okay, so it just makes sense.
It makes absolute sense.
So I guess I need to do that.
Yes.
Okay. Makes sense. Okay. I was looking for an excuse. I don't think I found one. But I'll wait till I get back. I'm going on vacation, so I think I'll wait till I get back and then I'll have it done.
Yeah.
So we were talking about, well, diabetes obviously and obesity are issues that our senior, well, not all, just seniors, but all of our patients see. Are there programs that you're aware of that you recommend for them to kind of combat those concerns?
Well, we encourage them to come to the wellness center here and exercise, work out, maybe swim in the pool. That would be an awesome program for people to get involved with.
Right, it's a good place to start too if
Yes, it
they're
is.
having a problem either with arthritis or with weight, and it's nice with the pool. I go in there quite a bit myself because I have arthritis in my knees, so don't have to deal with that stress and the strain.
That's an awesome way, low weight bearing.
And there's jacuzzi you can soak in afterwards too, so that works pretty well too. We are blessed to have this wellness center here.
Yeah, it's a very nice wellness center.
Yeah, it is, and I should use it more, but anyway. And I know, I think they have, well, we have our seniors, what do they call it? The Silver Sneakers program is a new one that they've started here at the Wellness Center. And it depends, I think, on your health through Medicaid, Medicare insurance, but a lot of them now cover that. I think more and more insurance is starting to recognize being a little more proactive instead of reactive to the issues. You see that?
Definitely. Yep. If you're proactive toward losing weight and good diet, you're more likely to stay healthy.
Right. And that does benefit the insurance companies too.
Yes,
so I think that's part of the reason they support that Silver Sneakers program. It helps them too. With the staff out at now, Dr. Zagara, right, is out at the Golden Valley Medical Center too. So the two of you are out there together. That's a good program. And it's convenient too. It's pretty much right in the middle of Golden Valley from both directions.
Yes, it is. It's a convenient clinic, a lot of good parking and
easy to get to. For yourself, now you shared it's about a 40-minute drive from Dolan Springs, and I'm not even sure, we'll maybe use you to help get the word out into the community that we do quite a bit with our patient transport bus as well, if there's folks that have problems getting in for their doctor's appointments.
Awesome.
That
Yeah.
we have that van available, and they can call the main hospital number, the 757-2101, if they need to make arrangements for transportation.
Very good.
Because that's important. Even like physical therapy, any of their treatments
Yes.
like that, a lot of times if they don't have transportation, they end up missing
Oh,
the appointments and their
Right,
follow-ups.
right.
So it's good to let people know about that.
yes, definitely.
So you've raised your daughters, and where are they at? Are they
They're
back
both in Michigan.
Okay.
Yes,
Do you
my-
have grandchildren?
I have one grandchild that
Oh.
was born 5 months ago.
Oh my goodness, so
and
new
then I
one.
have another one that's coming. Her due date's a week from Friday.
Oh my goodness, are you
So-
getting closer? There'll be two. They're awesome.
Yes,
have
I can't
grandkids.
wait.
I know. It's a little hard to be so far away.
I know.
But
yeah.
come this winter, they'll probably want to come and visit.
Yeah, we're already planning. Got a couple of visits planned. So,
Good.
Yes.
That's good. And we were talking about in Michigan, do you have other family there as well?
My husband's family is all from Michigan.
Oh, okay.
And my family is from Ohio, but only one of my brother lives there now. One lives in San Diego, one lives in
very
Washington, D.C., and my sister's in Colorado.
Kind of spread around.
So we are
then.
all over the
Yeah,
place.
same thing happened in my family. I have one
Yes.
brother still back in Minnesota, and the rest
Oh,
kind of
yes.
moved around. And I think that's pretty normal with our culture nowadays.
Yeah, cold country.
Yes, yes, and we get smart and leave.
Yes.
So you shared that you've been here a year, and when you were working out in Dolan Springs too, before you joined KRMC, and do you think that are the health concerns any different out in Dolan Springs and Meadview than they are in town?
It's a lot more rural out there.
Yes.
They're uninsured,
Yeah.
which makes it hard to keep good health care.
Right.
Yeah.
Absolutely.
So.
Again, I think that's one of the things for KRMC, that we have a really good qualifying discount program
That's
for
awesome.
people that don't have insurance.
Yeah.
And,
That's
so
great.
we want to make sure that, I mean, it's better to keep them healthy,
Yes,
obviously, and get those yearly
absolutely.
exams and catch things early
Right.
versus later.
Well
when
woman
it's-
exams, yep.
Absolutely.
For sure.
So for geriatrics, speaking of well women, then, so you're looking as a nurse practitioner, you do the whole body
Yes,
as well, too.
correct.
I mean, it's not, geriatrics is your specialty, but you do the whole body, too.
That's
It's not
right.
like your ortho, where you're just looking at bones or anything.
Yes,
like that.
that's right. That's right. We do a full compendium of care, mental,
Top to
emotional, yep, physical, the whole
Okay.
thing. Yes.
Inside and out. And that is good, because I think more and more in healthcare, they're recognizing how emotional, mental state certainly
Yes,
impacts our.
Plays a huge part in your health. Yeah.
So how long, what kind of classes did you have to take to learn about all of that?
Oh my, it was a long program.
Right.
Did everything from pediatric to
Oh,
geriatric.
you did? Okay. Because as a
And-
nurse practitioner, you have to look
Yeah,
at
you have
all
to
of
kind
it.
of look at everything. And then when you specialize in the last year, then you pick which section you want to go
Okay.
into.
Okay.
So,
So you started with the big picture of the
yes,
whole. and then
right. Pharmacology, yeah.
That's
Yeah.
a lot to learn.
It is, all the body systems. Yeah, it's a very intense program at Vanderbilt.
Excellent.
So,
And how many years is that?
The master's program is 2. I
Okay.
took it in 3 because of the RN initial year of RN. And then it was a little bit longer because I had a family too.
Sure.
So my husband was doing as much as he could and babysitting and working as a pastor. And
That's
so
a lot.
took a little bit of
That's-
extra time.
Yeah,
But that's
but-
okay.
Well, and
Yeah.
the end result is worth it in the long run.
Yes, it is.
Absolutely.
It is.
Well, and I know, like I said, that our patients are going to be blessed to have you here and have someone that
thank
can
you.
focus on that. That's really
Thank
important.
you. I do see adult as well.
Okay.
The nurse practitioner regulations have changed so that there is going to no longer be a geriatric certification. It will be all adult.
Oh, okay.
So currently I see anyone from 18 to the end of life
Okay.
or children that are over 100 pounds.
Oh,
basically.
okay. No,
So-
that's interesting.
Yeah,
'Cause
'cause
that's
their bodies function as an adult basically
Okay.
if they weigh more than 100.
very good.
So,
Well, I didn't realize that's the magic number.
Yeah,
Okay.
yep.
We're going to take a quick break, and then we'll come back and we can talk a little bit more about that.
Great.
Okay? So stay tuned. We'll be back right after these messages. What's the difference between a certified nursing assistant all the way up to a nurse practitioner? Welcome back to Your Health Matters. My guest today is Liz Smith, a new nurse practitioner at Golden Valley Medical Center. Thanks again for being on the show, Liz.
You're welcome.
We had talked before the break about that geriatrics is your specialty, but you do the whole person, and from basically age 18, all the
Yes.
way through.
Right.
But nurse practitioners, can we explain to our audience kind of the difference? Like, what's the difference between like a certified nursing assistant all the way up to a nurse practitioner? There's lots in between.
Yep, there's CNAs, which usually do a lot of hands-on patient care, a lot of times in the hospital, nursing home, that kind of thing.
Okay.
Then you have the LPNs, the licensed practical nurses. They do a lot of medication passing, general patient care.
Okay.
RNs do a little bit more management. Sometimes they do passing of pills, but generally they're management over LPNs, CNAs, and
Okay.
med techs, that type of thing.
Okay.
And then the nurse practitioner has a master's degree. The RN has a bachelor's mostly these days. Used to be you could have a certificate, now it's a bachelor's degree.
Okay.
Master's degree for a nurse practitioner currently, with possibility of moving toward a doctorate.
Okay. And I mean, a nurse practitioner, I mean, personally, that's who's been my primary healthcare provider for quite a while now. They pretty much can do everything a doctor can do, right?
That's correct. We do a lot of diagnosing, writing medication, getting people hooked up with labs or tests that they need done.
Okay.
And we also refer to specialists.
Okay. So the referrals that they need.
Correct, yes.
So you can be their primary care provider.
That's
Okay.
correct.
And I understand you're taking new patients, and
I am.
pretty much you've got some slots available almost
Yep.
on a daily basis. So someone
Same
could
day.
call.
Currently, it's a good time to get hooked in if
Right.
you're looking for a new PCP. And
Okay.
we do take patients the same day as they call often.
Okay.
Slots are available from 8 until 4.
Okay, and the phone number out there, don't want to forget to give that, 681-8500,
That's
right?
correct. Yes.
And so they can call and make an appointment that same day and come out and see you.
That's right.
That's a really good thing.
Yes.
And we talked again during the break about the importance of a well woman
Yes.
check. What does that do for a woman?
Yeah, well, it's good to come in and have a pap smear and a breast check, and then we hook you up with mammography or
Right.
whatever else needs to be done. We encourage that every couple of years, and if someone's not had it done, we can hook you up pretty quickly right now.
Okay.
So,
Well, and I know for myself that what I've come to see is that you can catch things earlier
yes.
if
yeah.
you do that on a regular basis.
Yeah, especially with breast cancer, you want to be checking yourself, doing self-breast checks, but it's
Right.
good to have a professional check as well,
Right.
at least, annually or every
And get
couple of
that
years.
script for the mammogram as
That's
well.
right, yep.
In October, of course, KMC focuses very much on the Catch It Early program, and we're offering
Yes.
$99 mammograms during the month of October.
Awesome.
So
That's great.
yeah, and that helps to get those maybe that couldn't afford it normally, or if they have a high deductible.
Right.
Sometimes that they'll have a tendency to put those things off.
Yes.
And the outcome for that would not be good.
No.
It's better to catch it soon.
No, that's right.
And then for men, I mean, we kind of joke about the fact women always got to get all the other. But guys should have that checkup
They
done
should.
too, right?
They should have an annual check, have their
Okay.
PSA checked, have blood work done, check their cholesterol, heart check. And once again, early detection of things is the best way to go.
And because again, if you catch those things sooner, you can usually turn it around for them.
Yes,
a lot of
right.
times, like you were saying earlier about exercise alone can make a big difference.
Right,
So if
right.
they're kind of starting to tend towards having the higher cholesterol or the weight's creeping up,
Yep, weight gain.
catch that early and
Yep, get on an exercise
get out
program.
there with the
Sure.
whip. Oh, correct. Very
Right.
good. Now you mentioned, and I found that interesting just before the break, that children, once they reach 100 pounds, that's when our bodies start becoming like an adult. I
Yeah,
didn't
you
realize that.
kind of start metabolizing a little bit different with more weight.
Right.
So, and usually you're going to see 100 pounds in a child who's 12 or 13.
Right. Okay.
You know, so.
That's when their bodies change.
Yes.
Interesting. I'd never made that connection before, but so we were talking about the nurse practitioners, and is that something you would encourage young people to go into now? I think more we're leaning more towards that.
Yeah.
Don't you think?
I think
seeing
so.
that more?
Yeah, I'm seeing a lot more nurse practitioners, girls that are going to RN school are thinking long term. You know, which is a great idea to think long-term plans.
Well, you can even do it in steps like you did. You start out to get the RN and then
work for a little while, and
Yeah.
then it's good to decide if that's what you really want to do, though, because it is a difficult program.
Just
Takes a lot of commitment.
Okay, and is that time? Well, it's both time probably and just having so much to learn.
Right, time and effort for sure.
Yeah. I know when you're talking about all the different classes you had to take, my kind of head was going, whoa.
Yeah, that and clinical hours requires, up toward 1,000 clinical hours too.
Oh my goodness.
So
Is that on top of the classroom?
Correct. Yes.
Do you do that as an extern program, or what is clinical hours? How do you get those in?
Well, when you go through like pediatrics, say you go through a pediatric rotation, where you have part classwork and then you go into the clinic and you work with all pediatrics or the hospital or whatever setting you choose.
Okay. Now,
So-
do you do that when you were in school? You mentioned you were in Tennessee at
Yes.
the time. So does the school have a clinic that they kind of work with, a partner with?
Vanderbilt is hooked up with Vanderbilt Hospital,
Oh, okay.
which is a huge teaching hospital, and they have Vanderbilt Medical School right there attached to the campus.
Oh, okay. So that makes
So-
it pretty nice.
Yeah, it's very nice. There's a lot of settings that you can get into, geriatric, long-term care. So it was a
Well, I
good
know
place to
that,
learn.
like at KRMC, we partner with Midwestern University for our residents,
Oh,
and we
right.
do both family practice and emergency
Yes.
physicians that go through training, and so they do their rotations up here.
Right.
But that's why I was curious where you had to go to actually get those clinical hours in.
Yeah, there's a lot of settings in Nashville to go
Very,
to.
very good.
So, yes.
So I'm glad to hear you talk about that, or that encouraging the young people to look at
Yes.
those options. I think, like I said, more people are starting, they want someone who has the whole person versus a specialty. And,
Well, we do refer to the specialists
Sure.
if there's need, so.
but for your
So it's-
day-to-day health care, it's nice
Right,
to have
it's-
someone that can look
Right,
at the
can
whole
look
body.
at the whole picture.
Yeah.
Right.
Are there anything else before we're here that you'd want patients to know that they should be aware of, or?
Well, I just encourage them to come and check in and meet us. We'd be glad to meet people, even if, they just want to talk before they set up an appointment. That would be awesome.
Okay, so that's a good idea
Kind
too.
of
They
get to
could
know,
call
feel
the-
comfortable. You have to feel comfortable with your provider.
Sure, right, okay.
sure.
And I know that, Golden Valley's growing along with Kingman, so
Yes.
as folks are out and looking for a new healthcare provider, it is good to know they have an option. One of the challenges has been that we have such a shortage of
Oh,
doctors
right.
for this community, and so it's nice that they have someone they could get in to see pretty quickly.
Yes.
And once they build that relationship with you, they'll be able to continue to get in.
Sure.
Right? 'Cause
Absolutely.
The
Yep.
new patient visit's a little different than if you've already been
Yes,
a
that's
patient
right.
for a while.
That's right.
And the other thing maybe we can just talk about briefly too, I'm sure you're aware of that we have the new patient portal off of our hospital website, the azkrmc.com, which they need to go to their primary care initially to get their first PIN number.
Right.
But then once they have that and they set up an account, they're able to go in and see their own records to get
Yes.
the results. That's kind of cool.
That is very
Have-
nice.
Have
yeah.
you had patients use it yet? Do you know?
Not yet.
Okay.
Working toward that,
Right,
though.
yeah, we just have to keep encouraging them to
Yes,
get signed up.
definitely. What a great way to be able to keep up on your lab tests and things
Well,
like
and
that.
eventually, I think they'll be able to make their own appointments online.
Awesome.
I think that's the long-term plan.
Yes.
It'll make that easier, and
That's
even
great.
communicate with their doctors. I've been told that at some point in the future, they'll be able to send emails to their
Oh,
doctor.
very
and-
cool.
Yeah,
Yes.
yeah, it's a new technology as we
Very
keep
nice.
going.
Yes.
So since you and your husband are out in Dolan Springs, do you get down to the lake a lot?
Have only been up to the shore a time or two.
Oh, okay.
Yes.
Well, we'll have to work on that also.
Yeah, I can't wait. I want to go out on a boat.
Yeah, very good. Well, Liz, thank you for being on the show today. And
Well, thank
as
you
I
for
said, I
having
think
me.
our community is blessed to have you here,
Oh,
and we're
thank
excited
you.
to have that opportunity out there. So
Thank you.
I hope you learned something new today. I know I did about nurse practitioners, and that you'll join us again next week when I'll have another exciting guest on the program. All right.
Wow.
Yay.
That goes so fast.
Yeah.